Hi everyone, it's me, Grace. So it's been a really long time since I have made a video regarding my transition and everything. And there's no real excuse for it. I'm just a selfish bitch and I wanted to take time for myself to really grow and learn and develop as a person. And yeah, so let's just jump right into it. It has been, sorry the lights are changing by the way, I'm in a hotel and I'm at a hotel, I'm pretty drunk, it's my cousin's wedding, so, lit. But, since the last time I made a video on YouTube, I think it was about, gosh, I don't even remember, it was about the YouTube ban on age restriction on transgender people. Lex, right over there, baby. So since then, I've grown and I've learned and I've developed as a person and a lot has changed. So I have been on HRT, hormone replacement therapy, for almost 4 years now. And, my body has pretty much developed as much as it can. My breast development has developed as much as it can. And a really fun and exciting news I have for everyone is that I am going to be getting a breast augmentation in a week. And I documented the process of that with like pre-op appointments, consultation, final pre-op appointments, and like the gist behind it and how difficult it's been. It's been a really big emotional roller coaster. This past year has financially been one of the hardest years of my life. Personally, on a personal level, I rushed into a second apartment and I never really had time to find a sublet for my previous apartment that I just signed a lease for. So essentially I've been paying 2 rents, which I take full responsibility for. But on top of that, I have also been paying off for my surgeon's fee for surgery because my insurance provider only covered so much, and then I had a sub payment that I was personally responsible for, and that sub payment was $2,000. And so my surgeon and I worked out a payment plan where I would pay out of pocket $250 per month. So roughly I was spending about $12,000 per month on 2 rents, surgeon's fee, food, hormones, which are roughly like $80, 80 whole fucking dollars for something that's medically necessary at this point, right? So this past year has been, like I said, very stressful financially, and that's a big reason why I haven't been making content. And I've just been busy. So I thought that with this video I could show my body. This is probably going to be my last video that I'm going to make before my breast augmentation, which I'm going to document, of course. But 4 years on hormones, I've developed maybe like a small 8-cup worth of tissue. I'm going to spin around. So like right there, I have a little bit of a boob. Oh, you can see my tattoo. But anyways, so I have a little bit of breast development, not much, but a majority of the development has been on my hips. So if I cinch in my dress a little bit, not a lot, I'm just going to relax my body, but my body is essentially an hourglass shape. And no, I haven't been pumped. This is just how my body has developed. So for every trans woman who decides that they want to opt for hormone replacement therapy, their fat distribution varies based on like your family and different factors behind it. And so even though I'm very ghastly white, I am biracial, so I'm French and Hispanic, and all the women in my family, we have decent sized breasts, but a majority of our fat distribution goes to our hips and our butts, and that is where my fat distribution has gone. And that's about it for hormone updates. Sorry, I'm really drunk. A big update that I have to say is that with any invasive surgery that you're going to go under for with anesthesia, right? It's basically your surgeon will notify you, depending on the surgery, about whether or not if you have to get off of your hormones. And my surgery, you have to get off of your hormones 2 weeks prior to surgery. And there's a full 2-page list of different types of prescriptions that you cannot take because it will fuck up your surgery. It'll increase the risk of bleeding during surgery, after surgery, you know, all this different type of stuff. And it can also affect your breast tissue and stuff. So I have been off of my hormones now for a week, and that has been a mind fuck. And then some. And I don't care that this video is gonna be fucking demonetized for my swearing. But it's been really rough because, you know, I have steadily been on my hormone therapy for 4 years now. And there's a lot of side effects from testosterone that I'm not familiar with anymore. I'm not familiar with having a sex drive. I'm not familiar with having morning erections. I'm not used to just like smelling different and, you know, feeling different and emotionally being different. And, you know, like, it's been a lot to deal with. I'm not even gonna lie. Like, I don't mind the fact that my penis is now, you know, a little bit more functioning and it feels better and it's more sensitive. But, you know, it is a little bit, I don't want to say the word triggering, but it's a little bit uncomfortable to wake up every morning to, you know, morning wood and to be angered easily, because with my hormones, it kind of leveled out my emotions and I never felt angry before. But when I have more testosterone in my system, I'm more angry, I'm more irritable, I'm less attached to people, I'm less empathetic, and I don't like that. It's like a weird shift within my psyche and within my emotions that's so uncomfortable because I'm such an empathetic person, even off of hormones, but it's still just like a mind fuck to be like, wow, I went from like caring so deeply to not really anymore. And that's been hard. It's been hard, like I just said, with paying 12 grand out of pocket every month. You know, there would be some months that, I'm not gonna lie, I would just eat instant ramen because I had no other options for food. I couldn't afford food at some points. I couldn't afford water, you know, filtered water. So, for my surgery to be in like a week feels so fucking gratifying because I feel so accomplished because I did all this out of pocket, all by myself. I didn't ask for handouts. I didn't ask for my family to help out. And it feels rewarding and also overwhelming to know that my surgery is in a week. Yeah. I don't know what else I could update you guys about. I think that's about it. So my next video that I'm going to be uploading is most definitely going to be about my breast augmentation and the you know, how it is as a procedure and the after effects of it. So yeah, it's really nice to have content again. It's really nice to have this online journal and platform again, because I have been getting a bunch of messages from people on my Instagram asking me where I am, where my videos are, and I apologize for that. But, you know, life gets the best of me, and as a clinically depressed person, shit happens. But I'm here, I'm queer, I'm here to fuck your man, and yeah. But yeah, anyways, I think that's about it for this video. Next time you'll see me, I'll probably be all anxious and drugged up afterwards. So yeah, until I see you guys next time, bye!